Okay. Good afternoon, everyone. I hope you got energized after lunch. Not the opposite. Okay, so we're back to our third session on dynamics of social insurance in Egypt. And we have our speaker, Caroline Kraft, and Serene Hanafi. And also we have our lead commentators, Dr. Hania Shulami and Dr. Amira Sahl. So both Caroline and Serene and Amira also will join online, and we're lucky to have Dr. Hania with us. Otherwise, I will be sitting alone. Okay, so let me just start by introducing Caroline and Serene. So Caroline is an associate professor of economics at San Cathedral University. She received her master's degree and her PhD degree from the University of Minnesota, and her research examines issues in development economics, primarily labor, education, health, and equality in the Middle East and the North Africa. And I think like most of us here in the room have worked somehow or another with Caroline. Also, we have Serene Hanafi. She holds a PhD in economics and a master in economics from Marseille School of Economics, and she's currently a postdoctoral at the University of Paris-Est Créteil in France, and her research experience includes applied econometrics, development economics, and migration. Okay, so both Caroline and Serene, the floor is yours. You have 20 minutes for the presentation. Please go ahead. We're looking forward.
Hello, everyone. I'm trying just to activate my camera. I don't know, it does not work. So anyway, I will start by sharing my screen. So thank you for the presentation. Today I will present with Caroline our paper on predictors and dynamics of social insurance in Egypt. We all know that social insurance coverage rates were falling since public sector hiring was curtailed in the late 1980s, and also with structural reforms in 91. Also, the private sector was unable to provide quality and socially insured jobs. So existing research captured rather declining coverage and disparities. And only some research were interested on duration to social insurance coverage. To the best of our knowledge, individual level dynamics that are behind gaining, either at entry, during, or changing jobs, and also losing social insurance, have not, to the best of our knowledge, previously been researched. And that's what we are interested in our paper. So the data used is the ELMPS, so the Egypt Labor Market Panel Survey. The specificity of this data is that it has two key desirable features for analyzing dynamics, informality dynamics, So first we have the panel nature of the data that allows to directly assess dynamics comparing the same individuals at 2 points of time. And here we have three available waves. In our modeling, we will consider the most recent wave, 2012-2018, but we will also make some comparisons with results from the other waves. And also the second specificity of the data is that we have a retrospective labor market history that could capture every job lasting 6 months or more, the nature and timing of initial insertion into the labor market, etc. Which allows us to have analyzed employment statuses. And for this, we consider the 2018 retrospective data since the 1990. We are interested in the working age population between 18 and 59 years old. So for the outcomes of interest, so as we will work on the informality dynamics. We look at the gain of social insurance. It means simply that you didn't have social insurance and known previous year, and it's like a dummy variable to say if you gain or not social insurance. Whatever is the employment status, so conflated with gaining employment, then we look at the gain of social insurance regarding or conditioning on being employed in the current year. Then we look at the gain of social insurance within employment. It means that you were employed previously and you are currently employed. So we compare either the 2 points of time in the panel or the year and the year after in the retrospective data. So that's why I'm talking about 2 points in time in the two type of data. We regard also the gain of social insurance conditioning on entry. So it means that you were not employed previous year. And here we distinguish between either those that are unemployed or those that are out of the labor force. We regard also the laws of social insurance. First, regarding those that had and thus employed previous year necessarily, but include, and also we could distinguish those that remains in employment but lose social insurance. So the first case is it combines the second case plus those that lose their employment. For the data and the covariate complexities, let me talk about this. So as we are interested in how dynamics have changed over time, we could have covariates. So regarding the outcomes that I have presented, covariates can be either from previous or current year. So both could be relevant, but only some are applicable. For instance, if we talk about previous employment characteristics, whether you were working in a formal firm or not, this only available for people who were employed in the previous period. So that's why we have different covariates could change with the outcome of interest. The data captures also changing job for the employed and also reservation wages for the unemployed, which could be interesting to see how unemployed people could value social insurance. And we have added some controls like time invariant variable like education sex, time varying variable, and worker characteristics and firm characteristics. So for the methods used in this paper, we first present a descriptive statistic, global descriptive statistic on social insurance dynamics using the two types of data. Moreover, we conduct logic model for gain and loss using also the two types of data regarding odds ratio, and for the retrospective data, as we have many observations for each individual, we consider clustered standard errors. So let me start by some descriptive statistics. So beginning with annual transition rates between 1990 and 2017. So if we look at the outcomes of interest here, we see that in 1990s, we have only globally 1% per year that gain social insurance. So independently on the employment status. However, if we look at those that are currently employed, we have 3% at entry among those that are employed in current year, which combines entrants and previously those that are previously employed. So these rates decrease over time. So we have a decrease in gaining social insurance. But if we compare those that were employed in previous year and globally, we see that the decrease is less for those that were employed in previous year. But anyway, the rate remains low with about 1% in the periods. If you look at the lows of social insurance, we see that we have a slight increase in losing social insurance over the years, even among those that remains employed. So even for this case, so we have also an increase, but with the half of the rate. If we regard only entrants, so their annual transition rates, we see that so the analysis for those that are non-employed, that were not employed in previous year and that employed in current year. At entry, we have 40% of people that obtained social insurance in 1990s, but this rate declined over time but more so for those that out of labor market, as we see in the last line, QE. Rather for those out of labor market in which we see a more decrease of the gain. If you look at the panel transition rate, so from the panel data, and we compare between the waves, the data from the three available waves, we see that the gain of social insurance was declining over time in 2012 to 2018 in comparison to the other waves. So whatever is the employment situation overall while employed in current year or while remaining employed in both years, and also for entrance. For losing social insurance, we see also that the rate was rising substantially over time, even when remaining employed. It is so the last bar when you look at those that were employed in the previous year and that currently employed. So we pass from 9 to 16 to 29%. So that's why it's a substantial rise. If you look at the annual transition rate by sector for the entrance, we see that at initial entry, we have 75% of gain of social insurance in the public sector and only 10 to 20% in the private wage, and only 5 to 10% for non-wage workers. So these rates declined over time for all sectors. So this decline starts for private and non-wage in 2005 and 2010 for the public sector. If you look at the panel transition rates for by sector, we see that the results are also consistent with retrospective data, with those from retrospective data for recent years. And we see remarkably that losing social insurance for those that remain employed is particularly high for those that transition to private sector with 52%, and especially for non-wage workers with 71%. So if I try to summarize some results from the multivariate results, so conducting the logit model for the three outcomes of interest, for gaining social insurance, rather being employed in the current year, for entrance, or for people that are employed both years, we see first that the declines are starting in 2013 in overall and entrant models. We have also detected some firm characteristics that are relevant with finding that public are more likely to gain than private or non-wage. So that's what we have also seen in the distractive. Workers in large firms, establishments are more likely also to gain. We found heterogeneous results by economic activity, and only in some models we have small difference for previously working within a formal firm. For job characteristics, in some models we have found, so here we combine results from panel and I'm talking about the two types of data also. In some models, we have non-employed entrants that are more likely to gain than employed. Also, those that are working in temporary, casual, seasonal workers are less likely to gain than permanent. Changing jobs would matter in retrospective data, but not in panel data, and longer time in job increases gain. We have found also that managers, professionals, technicians, plant and machine workers are most likely to gain. For finally, worker characteristics, we found that women are less likely to gain in some models. Married, especially men, are more likely to gain in some models, and also more educated, more likely to gain. We have also some geographic disparities between rural that are less likely also to gain, and the gain is rising and falling also with the age. So Caroline will present I don't know, Caroline, if you want me to...
If you can stop sharing, then I can proceed. Perfect.
Okay, so thank you. I will. The floor is yours, Caroline, for the next part.
Continue. Perfect. Thank you, and good morning from Minnesota. Sorry I cannot be there in person with you all in Cairo, but I'm excited to discuss our results. So Serene just finished discussing the GAIN results, so the multivariate models for gaining social insurance. So we'll turn now to those for losing social insurance. And you'll recall that we do this loss first for those with social insurance the previous year, regardless of whether they're employed or not the current year. And then we also specifically look at a model for whether or not folks retain or lose their social insurance among those who remain employed, because that's the group that remains eligible. There is interestingly not a clear time trend in losses after accounting for characteristics, but in terms of firm characteristics, folks who are in larger firms are less likely to lose their social insurance, at least in the panel models. There's some limited, not very clear economic activity, so those industry differences. Where there's a lot more clarity is on the job characteristics. Private wage folks, so folks who are in the private sector as wage workers, are more likely to lose than the public sector. Casual workers are much more likely to lose social insurance than permanent workers. And craft, trade, and elementary occupations are more likely to lose their social insurance than managers. In terms of worker characteristics, women and those ever married are less likely to lose, at least in some of the models. And more clearly, those workers who are more educated are less likely to lose their social insurance. In some models, those who are older are less likely to lose their social insurance. And as we saw in the previous model, in terms of location, rural and lower Egypt have higher odds of losing their social insurance in some models. So to summarize this, there are definitely some parallels in terms of gaining. The folks less likely to gain social insurance are often, but not always, the folks more likely to lose it, particularly in terms of sector and casual workers. We also looked at the value unemployed workers place on social insurance to try to understand a little more of the why. Why are folks not enrolling in social insurance, or their employers aren't enrolling them in social insurance, whatever the dynamic may be. So we're looking here at what we call the private sector social insurance reservation wage premium. Basically, this is the uninsured wage. So what is the minimum you'd accept for a job without social insurance in the private sector, minus the insured private reservation wage. So minus what is the wage you'd accept for a socially insured job in the public sector, as a percentage of the uninsured reservation wage. So this is basically, if people really valued social insurance, they'd be willing to accept a lower wage to get that. And then we'd be seeing a premium, a positive number here. But actually, we're seeing the premium is in fact 0. It's centered at 0, as you can see in the graph. The median is 0%, the mean is minus 18%. The 25th percentile on the low side is still 0%, the 75th percentile. Some people do value this at about 20%. So this suggests the unemployed often do not value social insurance, whether due to the high wage deduction, high insurance, high discount factor. You know, we can't get to the reason they don't, but we're seeing that this is not necessarily valued highly by workers. They're not willing to forego wages to access social insurance. So to summarize the dynamics, we see entrants are less likely to obtain social insurance over time. And when workers are working without social insurance, they're less likely to gain social insurance while employed over time, right? So we see this sort of what we call uninsured trap increasing over time. You're likely to get stuck in a non-insured state, and increasingly so. We also see, concerningly, a very much rising share of workers over time losing social insurance, even when remaining employed. They're not necessarily in the same job, but they are still employed, and they're losing social insurance. In terms of the predictors of gaining social insurance, we see in terms of firms, public sector firms, large firms, in establishments. In terms of workers, professional operations, more educated, older, and more experienced workers in their current job are more likely to be gaining social insurance. Those are also more likely to lose social insurance, those more likely to gain often, but not always, are less likely to lose social insurance. So we see this pattern of basically they're privileged workers who can access social insurance and keep it, and then they're disadvantaged workers who tend not to access it initially, and if they do, often lose. Interestingly, working within a formal firm, but not being insured, only predicted higher social insurance in one model, so that isn't necessarily a key margin. Now we want to note a number of limitations to our analyses. The retrospective data we use is subject to recall error, and that may be especially true for the exact date of start of social insurance. And we do, in the retrospective data, miss social insurance loss within a job because we just don't have the loss within a job. We do have the gain within a job. We capture this though in the panel. So for that, we have the panel. We lack information on the reasons workers gained or lost social insurance. Did their employer suddenly register the firm? What was it that led to the change? So understanding this in workers, both values and concerns for social insurance is really important for future research, as well as the employer perspective, why they are or aren't registering their workers. One thing we'll flag though is that the design may lead workers to place low value on social insurance. The unemployed individuals valued a job with social insurance at 0. Maybe this is due to its regressive nature. Hard to say on that. So I'll turn now to thoughts about how we can change policies in ways that might help address this declining coverage issue and the sort of informality traps we're seeing, the uninsured trap we're seeing. There's a lot of research globally on policies from other low and low middle income countries on what might work. One thing is premium subsidies. So helping pay the premiums for the social insurance system can be helpful, particularly initially. There's research showing job seekers may underestimate wage growth in socially insured jobs. So temporary wage incentives to enroll in social insurance can increase covered socially insured employment. Information campaigns and help enrolling with the paperwork can also increase social insurance. But this also is very much tied to the macroeconomic environment. You're tending to see globally that sustained employment growth is a key prerequisite that interacts with policy. So, enrollment assistance, information campaigns, premium subsidies work better when there's a robust economy that's more likely to be able to afford to offer social insurance. So we can change some of the system details as well. We see higher willingness to pay among workers for social insurance that is less expensive, that is more flexible, that has better benefits and better administration. These are not free reforms, but they do tend to pay off in terms of workers recognize the higher benefits when the social insurance system has these features. Egypt has been really working on a number of aspects here. There have been recent reforms to firm registration. There's the new micro, small, and medium enterprise law that aims to register unregistered firms. But a question remains, can firms afford the cost of registration? And if they do, are the benefits worthwhile? Or are further reforms needed? And there were reforms to the social insurance system in 2019 that reduced contribution rates, but they're still regressive. So future reforms could aim for progressivity there. More dramatically, and I think this is something we're going to debate a bit tomorrow, is changing the system entirely. One possibility, I'm not specifically saying this must be done, but a major potential reform that often gets discussed globally is moving from payroll to consumption taxes for at least part of financing social insurance. So no longer contributory, moving to a non-contributory social insurance system, potentially universal, at least for some minimum benefit. The trade-off here is there are more benefits in old age, more people get covered, but people may be more willing to work for unregistered firms without benefits and workplace protection. There's some trade-offs there. But this could also help with labor mobility. For example, folks may not want to leave a socially insured job to start a small business. And if they know that their social insurance is not contingent on their job, they may be more willing to start businesses and switch jobs and lead to more efficient allocations of human capital. So this is one possibility to consider and discuss is should we move from a contributory to non-contributory system?
Carolyn,
All
just
right, thank you.
You're done. Thank you.
I'm done. I'm tired. Did I time it perfectly? You're about to tell me?
Very great. Thanks for sticking to the time. Thank you. Yeah, thanks. Okay, so thanks, Carolyn and Serene, for the interesting presentation. And now we're here from Dr. Hania Shulami, who's and Dr. Hania is an associate research professor at the Social Research Center of the American University in Cairo. I don't think like we need to introduce, yani we all know Dr. Hania. She's an anthropologist, and she got her PhD from the London School of Economics and Political Science. Please go ahead, Dr. Hania.
I have one arm, so you need to bear with me when I'm shifting through my presentation. I don't have slides, but I've written out some comments. I'd like to thank ERF for inviting me and commend the paper. It does provide, it's producing facts, which is always useful. So through this analysis, which I can't critique because I'm not a statistician, there may be terrible things wrong with the multivariate models, with the regressions, maybe not, but I trust Caroline and Serene that they've done a wonderful job. And it does provide new insights and demonstrates that multiple dynamics are creating this drive towards informality, lack of protection, but it also shows that there's choice involved in this because the models are not producing consistent findings. And in some models, it's, and as we heard also in the morning, that the better off are also choosing not to be insured. I'm wondering if anyone here isn't insured. Are we all insured? And are we sure of that? Yeah, because I think this raises the issue of these transitions in our economy, creating new scenarios for what we want to do as workers and how we define benefits and protection. And I think the findings on the reservation wage and the fact that people don't value social insurance are particularly interesting. And then they point to ways to reform the system. And I think this is where I may have some comments or differences with the paper. So going back to the paper, it highlights the key predictors of gaining or losing insurance coverage. And this invites us to look at sectors in terms of relations of production and reproduction and the regulatory frameworks that enable to or impose social insurance. So the challenge is how this works. How should this be read? I mean, these facts, if we take them as facts, what should we read in them? What should we be looking for? And this fine analysis can't answer these questions because statistics can tell us a lot of what's, but very few why's. And so we have to look beyond the statistic and to think of why is this situation, why are these trends the way they are? And I think in the morning, and the two papers presented in the morning were quite complementary to this analysis because they kind of broach some of the why questions. Iren's and Reda's paper on design and Ragi's paper on his decomposition in terms of sector and within sector and structural factors. But I think the biggest distortion in our analysis, actually in the three papers, even the design paper, is that it does not engage with the system as a system. Because policy and practice are very different things. And whereas we can look at the design, we have no sense of how this system works in practice. What are its distortions? How is it in implementations? How is it in operations? More importantly, where are the decisions made? By who? And what is the intent of these decisions? So is this a system that is working towards efficiency or efficacy or austerity? Is it trying to save money? Is it trying to make money? And of course, as everyone who works on these issues knows, that the biggest lump of public expenditure on social public expenditure is on subsidizing social insurance. So 38.8% of what we spend on social spending, which is a lot, I mean, which is not just karaman takaful and tamween, it's 40% is spent on subsidizing these accounts. And according to the Ministry of Finance, the expenditure on subsidizing social insurance has increased by 80% in the last 10 years. So the period where the paper is describing a loss in coverage, and in the morning where we're seeing a drop, is actually also marking a tremendous increase in terms of the government's own accounts. So, so where do we go from here? I think I'm going to suggest 4 things and then stop. One is that and the paper also needs to do what James Scott, the political anthropologist, sociologist, says, see like a state. Because seeing like a state is not seeing like Ragi or Irene or researchers or so on. The state sees us very differently. The state thinks that it can control minimum, maximum, that it controls wage brackets, that it knows how to control markets, that it understands what people want. And for example, an example of that could perhaps we should think about when we're looking about coverage, it's not just the premiums that people pay and what is deducted, but once you are registered in this system, there is an avalanche of fees that are not called taxes and that are not deductions to which you are liable. And none of the papers talk about this. The number of fees and deductions, which for well-earning people is small, but for minimum wage or people in wage, particularly non-agricultural, you are forced to pay صندوق تحيا مصر, معونة الشتاء, all sorts of contributions, fees, stamps, and so on, which really does make people count their pennies and think before they want to appear to the state. So I think we need to flesh out these issues a little bit when we're trying to understand the trend. And the earlier paper noted the problems with documentation, with outreach. I'm almost done. But there again, I think it's just assuming, it's again talking like a state. It's as if only people knew, then they would respond. But let's look at, for example, investment, debt, and how much money people need now rather than in the future. So we need to, that's my second point, look at alternative forms of social insurance that we don't recognize, but that people recognize very well. Whether it is to opt out of coverage, but have the income now to invest in something or buy something or buy a bride's trousseau, you're doing it on installments, we all know that particularly the middle and lower middle class are in debt. They're paying installments. So, and on the other hand, even the better off, we all sense the 40% inflation now, but inflation has been steadily going up even before we were hit by this terrible inflationary wave, and therefore that it is better to bank on something else rather than pay into your coverage. My final 2 points is that in these papers, and I'm talking about all the papers, we're looking at how people are interacting with the system and with the market. But we don't understand so much about these 3 players. So the factors relating to the social insurance system are covered somewhat in the design paper, but then there is that issue of trust that I think we need to understand better. There is that issue of bureaucratic decision-making. There is a lack of voice for workers. Now, it's as if something that doesn't exist, but really, we have no governance in this system. And I think that lack of governance over the accounts, over the payment, over various decisions on this money I think that could create a dynamic better than outreach. What's outreach? I mean, outreach is the state telling you something, but engagement is something else. Factors relating to employers, low productivity leading to low wages, of course, inflation, but so labor supply issues. There are very serious labor supply issues that are also affecting these decisions on who to cover and whether to cover. And of course, workers' preferences. And here I just like to point to my final point is that if we really do need to have more context in these papers, or at least to risk an opinion about the system and how it works, or that it's a distorted system, or that we don't know how it works in practice. We need to decentralize that, to look geographically, because in different geographies, urban, rural, agrarian, non-agrarian, and I'm still talking about non-agricultural work. But finally, we also need to look at the link between social insurance and other benefits. Maternity protection, health protection, child grants, all of the kind of things which make the public sector attractive. It's not just the social insurance and the benefit that you get at the end of it, but it's also that you are getting the returns on registration while you are working in a significant way. You're having access to subsidized goods, you're having access to all sorts of credit, microcredit, and so I think it's important to link social protection, social insurance to these other benefits and see the dynamic between them. And thank you. Sorry.
Thanks a lot, Dr. Hania. Very interesting points. So let's now we are should listen to Amira. Amira, yes, Amira is here with us. So Amira, just a second. Amira's Amira Shed, she's an assistant professor of economics at the Faculty of Economics and Political Science, Cairo University, and she's also a senior policy manager at the Abdel Jamil Poverty Lab of the American University, where she leads research and policy partnerships for evidence generation, dissemination, and the use in the social protection sector. So Amira, please, you have 10 minutes.
Thank you very much. Can you hear me well?
Yes, go ahead, please.
Okay. Thank you so much for inviting me to this very important event, and I'd like to kind of thank the ERF for always taking the lead on these critical topics. And I wish I was able to join in person, but let me seize this opportunity to share with you some of the thoughts basically that came across my mind as I was reading the very interesting paper of Caroline and Seren. So at the beginning, when I read the paper, I wanted to touch upon like three key points: the big picture, and this maybe to Dr. Hania's point on how social assistance or social insurance complements other policies that should be put in place, especially in times or at the times of shocks. So this is the first thing that came across my mind. The second thing that I wanted to share with you some of the insights on social insurance and how we can encourage individuals to take up social insurance, because this is a challenge that's worldwide. It's not specific to Egypt or low and middle income countries. And the third topic that came across my mind is the formalization of firms and how formalizing firms could intersect with the take-up of social insurance as part of like, it's usually like the government efforts to formalize firms with the end goal of extending social safety nets to employees. So these are like the three quick thoughts that came across my mind. And I would like to be, I would be as brief as possible touching upon these points. So the first thing that came across my mind to Dr. Hania's point is the big picture. So social insurance is important, but it's not important per se. It falls under the big umbrella of social protection. And when we here discuss the social insurance or the pensions, the importance of these tools is that basically they prevent people from falling into or under the poverty line. So since COVID, a lot of the attention has been drifted towards like cash or in-kind transfers to deal with this shock, and this is fine. We should be kind of targeting the ultra poor, trying to improve the lives of people experiencing chronic poverty, etc. But what worried me personally is that not much attention has been assigned to social insurance or pensions programs, which constitute cornerstone policies for preventing people from falling into poverty. So I could be like, now I can be belonging to the middle income class, but with a health shock or like a bad harvest or anything, this could be kind of driving me under the poverty line. So this is the first big thing, or like the first big idea that came across my mind. And also, when I also was checking the recent statistics on social protection programs worldwide, and here I'm displaying the programs in developing countries. I've seen that social insurance and social insurance programs and pensions policies, they have been implemented by 54% of developing countries, while other programs such as unconditional cash transfers or like conditional cash transfers, in the case of Egypt, we can like, you all know Takaful and Karama, etc. They have been gaining a lot of attention recently compared to social insurance and social pensions programs. And this again worried me a lot, that we need something sustainable as like an adaptive framework, rather than focusing on targeting the ultra poor only, which is important, very critical. But again, I was very happy to see this paper on social insurance, which I think is very timely. A third graph also that worried me is here I'm plotting the association between the GDP per capita spent and the total social insurance expenditure as a percentage of GDP. And you can see here that Egypt is actually, compared to its GDP level, it's spending relatively more on social insurance, which also struck me, because I was thinking that Egypt is spending very low compared to the GDP level. But when I saw this association, I was worried that something is not going right. It's like the targeting challenges, the delivery challenges, the institutional challenges in Egypt could be explaining this kind of relatively high spending on social insurance compared to our GDP per capita at Egypt. And this actually encouraged me to dig deeper into the idea of the challenges that we face specifically in Egypt. So we know that high-income countries, even they face challenges when it comes to social insurance in terms of financing, design, and delivery. And all these challenges are understandable, and we all realize this. But in the case of low and middle-income countries in general, and Egypt in particular, challenges could be additional challenges could be related to the targeting, given the large informal sector and the limited information, which is very critical to, maybe this could kind of complement the analysis of the paper, that why are we seeing these trends? Because I recall that Seren started her presentation by doing what's going on, the low demand on social insurance, etc. I've tried to dig deeper and see why are we facing these challenges. So certainly in Egypt, we face challenges with targeting, given the large informal sector, limited information, etc. And also, and this is also again to Dr. Hania's point, that challenges with delivery, given like the weaker institutions and like the implementation challenges in Egypt. So the low take-up of social insurance, etc., they explains a lot when it comes to implementation from like the state's perspective, and our incomplete insurance and labor markets. So this was like the big picture I wanted to kind of discuss with you first. And then I also wanted to draw your attention to social insurance, but in the broader sense, that at the beginning, we were focusing on social insurance or social benefits, basically in the labor markets. And this is very critical, very important. But again, now with the rising challenges, health challenges, climatic challenges, and other agricultural risks, etc., it will be important that we kind of broaden our scope to try to insure beneficiaries against other types of shocks. And here we refer to, of course, economic shocks, the situation in Gaza, the situation in the geopolitical tensions, the refugees crises, and we will all bear the cost of this, we know that. And we also want to insure beneficiaries against health, climatic, and other risks. And here again, when I'm referring to social insurance, I'm referring to mostly middle-income people who are very, very vulnerable now to fall below the poverty line. And this is what worries me the most. And of course, a lot of important questions came to my mind while I was seeking a better understanding of the social insurance landscape in Egypt. And part of the insurance that the government is doing is like insurance against income loss, and this is fine. But also the big picture of like the disability insurance, the workplace accident insurance, life insurance, etc. My concern is that we are lagging behind on all fronts, to be honest. Also, insurance against expenditure loss. You all know the health insurance law and the implementation and the challenges with the implementation and how this has been taking ages and ages. And all these kind of challenges intersect at the end with the social insurance landscape in Egypt. And the figure relating the GDP per capita with our expenditure for social insurance brings to our minds a lot of questions when it comes to how we can define the eligible people that we should start with, how we can reach these eligible people, how we can encourage people to take up the insurance programs, how can it be appealing to them, because at the end it's their decision. You cannot force them. If you force them, they will drop out in any way, and we all know this. And also the additional challenges that we face now when it comes to women, refugees, and with the geopolitical tensions. So the climate change, the increasing frequency of extreme weather events. So all these ideas came to my mind while I was reading the paper, that there's something going wrong. The paper perfectly plotted the long trend. And it's at the moment it's perfect, but now we need to go the extra mile to see what's going on behind the scenes, what explains these the results of this paper. To give you also
Amira, your time is out, huh? Please wrap.
Okay, perfect. So I will skip all like the insurance slides, and I will conclude my presentation with formalization. You all know the idea of that formalization is usually part of the greater efforts of the government to extend social insurance or like social protection to individuals. Evidence to date suggests that providing information or reducing the direct cost of registration failed to increase formal registration. Formalization itself had a limited effect on business performance. And the only thing that could kind of create some incentive for formalization is providing access to social insurance benefits. But all the literature on providing info, direct cost, reducing the registration cost, all of this, based on the evidence that we have not been effective. And I will conclude by this slide on efforts for formalization and how these efforts actually, unfortunately, I was shocked to see this, but they even like easing business entry procedures, everything didn't work with formalization or like didn't increase formal registration. The only thing that increased the likelihood of firms to formalize is giving them access to social benefits or social insurance. So this is the only thing that we have evidence that it did intend to increase formalization. And this suggests that firms may need additional incentives to formalize. And once they formalize and they are there, we know that social insurance will be extended to their employees. And this is the one study that I'm referring to was in Brazil, which shows that opening access to social benefit programs was associated with a 76% increase in registration in Brazil. So I'll pause here. Shireen will shut me off, but I'm happy to continue the discussion with you.
Thanks a lot, Amira. Thanks for the interesting notes and work about the JPAL work. I think anyway, the authors will get your presentation. Sorry to shut you off. So now we have 20 minutes for, or like a little less, like 10 minutes for open discussion. If anyone has a comment, but just something like we have to note, like if we, I was thinking about, like as Dr. Hania was saying, let's think as a state or see as a state. But like from the analysis of Carolyn and Serene, we noticed that some, not a negligible percentage, have lost social insurance. So if we go back to Dr. Mervit's comments about lack of information about the social insurance and the value of social insurance, we have not a negligible percentage of people knowing about social insurance and already insured, and they, like for some reason or another, lost it, or either they opt for not having it, or it was a forcement by some something we maybe need to think about. So this is just like something that I feel like we could be interesting to note out of the presentation of Carolyn and Serene. Thank you. Yes, let's start with Dr. Raghi.
Yeah, I think that the point about understanding more about those who lose social insurance after they actually have it, it would be critical to know whether they're losing it as a result of changing jobs, and that would indicate something about the mobility of social insurance across jobs, or as a result of losing a job, right? And so I think that aspect is covered, but are some people losing social insurance in the same job without changing jobs? They're still being dropped from the social insurance rolls. That, I think, from a policy perspective, is a critical one, to know circumstances under which people are losing social insurance.
Iran, yes, please.
So on the point of losing social insurance again, I have a story to share from one of the KIIs that I did with employers. So the idea was that because of this rise in the minimum insurable wage and the costs, what happened in 2017 is that employers would offer early retirement package, like to finalize like their contract, their workers' contract, and help them get a pension, right? And then recruit them again without anything. So they actually lose, but then remain in the system, working, receiving a pension, and working. Now, we need to make sure of this using the data, and we need to provide evidence for these kind of stories. But that's the stories I heard. And then, like, they also said that the government, seeing as a state, noticed that behavioral change due to the minimum insurable wage, and then they issued a kind of a decision or something to kind of curb this early retirement. So I think the next steps for us to do, as from the academic perspective, is to understand really if there is a surge in early retirement pensioners and how this relates to their current employment status.
Thank you, Iran. Any other comments? Yes, Farah, go ahead, please.
Presentations, and Dr. Hania for the insightful comments and thoughts. So I have a genuine question. Since we're speaking about the dynamics of social insurance, also keeping in mind Dr. Asad's point in the previous session regarding basically how the behavioral element comes into play and basically governs how people make choices and decisions. For example, withdrawing or not wanting in the first place to contribute to enroll in social insurance so that they can benefit from takaful and karama, for instance. Dr. Hania reiterated a similar point, which is basically that people do not want to register or to be seen by the state in the first place. So keeping that in mind, now that we're trying to advance social insurance as being a key or a core element of social security, would we want, as the question of efficiency versus effectiveness, would we want to promote more social insurance or social assistance / basically grants? Why am I saying that? Because in some cases there is like an overlap. So there is, for example, say the unemployment insurance, and there is the unemployment grant. So if we are to choose between either or, given that, again, it's a question of efficiency versus effectiveness and lack of resources. Given that in the ILO scheme that they're trying to promote, the floor, the horizontal coverage that covers most people is mostly about grants. Now the insurance, be it contributory or non-contributory, is a second layer of social security. It's like the vertical coverage. So from that point of view, would we want, if we are to choose between the two, to choose this one or that one? Sorry, it was a bit big of an introductory note to get to that, but I want us to think all together. Like for instance, for me, I am sure that insurance is better than grants, although grants are more universal or can be more universal, because insurance is unfortunately employment-based in most cases, and we've been speaking about that. But I would want us to think about solutions that are feasible when we approach the states with our approach, knowing that our countries are facing crises, like Egypt, Tunisia, and Lebanon are facing one of the biggest currency crises in recent history. So yes, genuine question indeed.
Thank you, Farah. Any other comments? Last comment? Okay, so we'll give the floor. Question? Okay, I thought you're gonna. Okay, so Dr. Hania, please.
No, I'd like to ask Caroline and Serene and what do we mean by social insurance? Because I think it's a bit of a buzzword. It's not clear. What level of benefit qualifies as insurance? When is it worth it and when isn't it? And the very exciting thing about this work, and is that it can explore these things, because insurance, it's Irene's comment about early pensions reminded me that is supposed to be a form of insurance that has failed tremendously by the time it's computed and by the time what you get at the end. Is this insurance or not? So it's a question about the analysis. What else? It's a bit of a residual category of social insurance. It's something that you save part of your wages. When you begin from a point of low wages and high inflation and problems in the labor market and a high degree of informality, then I think it would be nice to have at least a taxonomy of social insurance that is viable, social insurance that is non-viable, that can be discounted. As Farah said, if Karama and Takaful benefits are higher than social insurance benefits, then, I think that distinction needs to be made. Thank you.
Okay, so I'll give the floor to Karen and Serene. Just like if you can just summarize your responses in a minute or two, that would be great. Thank you.
I'll try to start very quickly. So I think, thank you for all these wonderful comments and great points. And really, I think this is all part of a larger discussion we're having today about what should social insurance or social protection look like. And that came through very much in the discussants' comments and the questions. I'll start very quickly with the point about job loss that several people raised. Is certainly one of the more unique contributions of this paper. And we do look at whether job loss is related to changing the job only in one of the models, and it's a small difference. So there is an appreciable fraction. I mean, measurement error in the data is always an issue, but there's an appreciable fraction of people who are losing social insurance within the same job, according to the data. So that's very concerning. And I think that ties back to the bigger question that a bunch of folks were raising. Is it worth it? Is the current social insurance system worth it? And I think a lot of people are looking at the benefits versus the cost, and costs here include the cost of all the additional fees and dealing with the bureaucracy and in relation to inflation and all these other challenges, right? And they're saying, no, it's not worth it. And that's part of a dynamic here. That doesn't mean we should just blame people for that decision. You need to change the system so it works better. And that brings us, I think, to the larger question of, should we be having employer-based social insurance, particularly as currently structured, where the government ends up very heavily subsidizing? So it's already a regressive system, and the government's subsidizing social insurance that goes to the relatively better off. And I think that's an important discussion about how we can either change the existing system or just move to a different system. Is that the way to go? I can't say on behalf of what's going to work best, but I think that's something to consider. Serene, do you want to add anything to that?
Okay, Serene, do you have any? Fine, good.
I have just like a global answers, not answers, but global remarks. So I would like I would like to thank you so much for your discussions. So these discussions are very enriching, because it's sure when we are statisticians, we don't have like a vision on the policy, on the realistic context, and what could be realistic to make and what not. So so it's very interesting, like, to see the context and to try to encounter more, and to see if what we suggest as policy recommendations, so that's what we retain from statistics, and that's what we suggest when we inspire from other experiences, etc. But it's interesting to see the context and to see, as a state, what could be realistic to do. Moreover, another point is that sometimes statistics is not enough to understand many mechanisms, and so maybe to complete with the qualitative data and more specific surveys on these issues, in order to understand better how people make their choices in order to value social insurance or not. So that could be interesting. That's why it could be interesting to conduct like qualitative surveys that could be specific to this issues that are very important. And finally, so Amira was talking, and also Dr. Hania, about the global. So it's very important to look at the social protection as global view regarding other benefits, not only for the working population, but the other benefits that concerns everybody, not only working people. So this is very important. But in our paper, we were just focused on those that are working. But in other paper, or as a further discussion, we could it could be interesting to talk about the other categories and the other part of social protection that is not only limited to those that are working. So that. Okay. Thank you so much.
Thank you. Thanks, Carolyn and Serene. Amira, any final point? You're fine? No? Let's move to Dr. Hania with like one last burning.
One last suggestion is for to look at the Ministry of Justice archives on the legal cases involving تأمينات, and the Ministry of Social Solidarity and الصندوق الخاص والصندوق العام, because they're a tremendous source of information on contestations around social insurance. And I really encourage anyone to just work on that, because it is available data. Thank you.
Thank you.
One final comment from my side, if I may. So I also encourage the authors to go into the database of the Ministry of Social Solidarity on the informal workers, because I know that there is like a database sitting there on social insurance for informal workers or irregular workers that started with the 500 Egyptian pounds for fishermen, etc. But then they received a lot of funding from entities to expand this social insurance to like pilots to irregular workers, whether they.
Amira, we lost you. Okay. We lost her. Okay, I think we got Amira's recommendations. Thank you, everyone. Before we kick off the session, thank you, everyone, for the session. Thanks, Carolyn and Catherine and Serene. And thanks, Dr. Hania. Thanks, Amira. It was really, I think we had a good discussion. Thanks, everyone. And thanks, ERRF, for organizing the session and for introducing it. Thank you.
Thank you.
All set, يا دكتور؟ So Iran, Gaia? Okay. Dr. Heba, Iran will be with us in a minute, so we can start. We can start with the presentation. Caroline and May? Sure. Iran knows she doesn't have to be there. Iran is coming in. But we start before she arrives? Yes. Good afternoon, everyone. And we're just waiting for Professor Iran Selvanes, but I think we can start. So no, I'm just saying who's on the podium. Okay, so we have Professor Heba Nassar, who's one of our two commentators. And the presentation is by both Caroline Kraft, who was with us a while ago, and May Heb, on a topic that I'm extremely interested in, working conditions in the paid care economy in Egypt, improvement or deterioration. So perhaps we can ask Caroline to come back and present her paper. Yes.
Mai will be starting and then I'll be taking over. So I think Mai, you can begin.
Thank you so much. I will share my screen now.
Faddali.
Thank you. So I would have loved to be with you all in the room, but I'm glad to have the opportunity to present today our work at collaboration with Caroline Kraft on working conditions in the paid care economy in Egypt. And I see it as a complement to what we have heard today about social insurance coverage in the economy. So I will start with the motivation to conduct this research and our hypotheses. So the motivation to look into the paid care economy is that we have evidence, well-established evidence about the importance of the paid care economy as a key support for human development, and especially for women. It works as an employer for women, and it also facilitates women's employment through redistributing the care work from being unpaid to being paid. However, unfortunately, little is known about the evolution of the sector. especially with regards to the working conditions and the pay gap, the gender pay gap. And with what we have, what have been developing in the Egyptian economy, the structural reform and the contraction of public sector employment, there have been some challenges with regards to access to services and jobs, especially decent jobs, particularly for women. This have led us to explore the evolution of care employment in Egypt through the period from 2009 to 2021, and we mainly focus on working conditions within the care economy. So here are the hypotheses that we're going to test in this paper. So we, for the first hypothesis, we focus on paid care employment and whether it has expanded over time as a share of total employment. And this has been in light of the ongoing efforts to expand education, childcare, but also access to health services. And these efforts of expansion of these services are expected to lead to an increase in paid care employment. With regards to our second hypothesis, we focus on the privatization, so whether paid care employment has become increasingly privatized. And we see that in light of the structural reform and ongoing efforts to reduce public sector employment. And with regards to our third hypothesis, we focus on the working conditions. So we try to see whether the working conditions in the care economy have deteriorated over time. And we mainly focus on benefits such as the social insurance coverage, as this is associated with other factors and workers' rights and benefits. We also test for a care pay gap and whether it has widened over time. Now moving on to the data that we have used in the analysis, we mainly depended on three main data sources: the Egyptian labor force survey over the period from 2009 to 2021, and this is our primary data source for testing our hypotheses. We also depended on the Egypt labor market panel survey for the years 2012 and 2018, which gives us additional details on the working conditions in the care economy, and these variables are not available in the labor force survey. So it gives us a zoom in on the working conditions, so to say. And our third data source is the economic census rounds for 2012 and 2017, and it provides us with a picture of changes in care firms. With regards to the universe that we focus on wage workers. And we also, this is how we define the paid care economy. We examine both care industries and care occupations. The occupations cover health, teaching, and social care. The industries cover education, human health, and social work, and also domestic work. The methods that we implement in the analysis, we mainly focus on descriptive statistics on care work, and this is used particularly to show the working conditions and how they change over time in the care economy, but we also use linear probability models to test the hypotheses. So we mainly have a linear time trend, but we also focus, given the large gender differences in care employment, we also focus on not only on time trends, but also gender interactions. And to account for for any composition drivers, we also include additional models with control variables, sociodemographic characteristics, such as age, gender, region, in addition to other variables. Moving on to the results with regards to the working conditions in the care economy. Here we see the care employment as a share of total employment, total wage employment. And if we start by the lower panel here, we see that there is a decline in care employment as a percent of total wage employment. But if we divide it by gender, so we see that this decline is mainly driven by the decline in the share of men working in care employment as a percent of total employment, but not for women. So this shows that opposite to our first hypothesis, where we expected the paid care employment to be expanding, what we see is a shrinkage. So it is actually shrinking and not growing, and it is shrinking for men, but not for women. Moving on to the second hypothesis regarding whether the paid care employment has become increasingly privatized. So we also descriptively look into this hypothesis or test this hypothesis. And here we present the private sector share of care employment by gender. So the lower line here, the black line is the total. So if we look at the total, we see that the private sector share of care employment actually increased over time. It increased from 13% in 2009 to 23% in 2021. And if we look at the differences by gender between men and women, we see that for men, it's the dotted black line. We see that it also increased for men, but the increase for women is actually larger than that for men. So we can conclude from this that privatization was larger for women. With regard to our third hypothesis, we were trying to test whether the working conditions have deteriorated over time in the care economy. And here we look particularly into the social insurance coverage to look into this aspect of the working conditions. And again, if we look at the total, so this is the percentage of care employment with social insurance coverage, what we see from the total that there is a decline in the coverage of social insurance in the care economy. However, if we divide it by public and private sector, we see that this decline is mainly driven by the decline in the private sector rather than in the public sector. And we also, what is important to note here, that in the public sector, it is almost a universal coverage with the percentages very high. They are actually very close to 100%. While in the private sector, we see that the percentage is actually very low, almost lower than 50%, and it is declining over time. What we also see here is that the decline in the social insurance coverage in the private sector is higher for women compared to men. So we can conclude that the informalizing trend is actually larger for women. And now we move to the second part of the presentation, which Caroline would be presenting. Caroline, do you want me to continue sharing my screen?
If you can stop sharing, then I can
Okay,
share.
sure.
Perfect. Thank you. All right. Hello, everyone. Excited to be back with you again, and appreciate your bearing with us being online. All right, so I'm going to talk here about some detailed comparisons of working conditions using the Egypt Labor Market Panel Survey 2012 and 2018 and comparing across three groups. We're going to compare those in care versus not care employment. And remember, care employment is care occupations and industries. Either of those you consider them care employment. We're comparing by gender and private versus public sector working conditions. So digging into these a little bit, these figures are looking at the percentage of, and we're looking at wage workers still, right? Percentage of wage workers who lack a contract. So starting at the top here, we're looking at this by care versus not care employment. And care employment workers do generally have better working conditions, particularly because the public sector plays a large role here. So we see that folks who are in non-care work have higher no contract work arrangements. They lack contracts. And the share of no contract employment is smaller within the care sector. But there is a rise from 2012 to 2018, right? Particularly among care employment. Still fewer folks there have no contract, but it is a rising share who have no contract. In terms of by gender, the second panel, women are just slightly more likely to have no contracts than men within care employment. So again, this has risen in terms of no contract over time, but it's risen relatively in parallel for men and women. The private sector really stands out as the employer without contracts, right? So the percentage with no contract in this bottom panel, we're focusing by sector in 2018. And we're seeing that in the public sector, few people, whether in care work or not, lack a contract, whereas in care employment in the private sector, and particularly not care employment, even more so, folks lack contracts. So there's some important contrasts here, primarily in terms of worsening conditions over time, and then lacking contracts, particularly in the private sector among care employees. Turning now to permanent jobs. So these are good things. These are showing the percentage who have permanent employment. And this is higher in care employment than non-care employment. It's declined slightly in both sectors over time. So that's what we're seeing in the first panel when we look at by care and non-care employment and the percentage with permanent jobs. There's this decline over time in terms of having permanent jobs, but in both sectors. In terms of permanent jobs by gender, in care employment, so this is focusing within the care sector, again, we're seeing some declines for men, but a similar level for women. So 86% had permanent jobs, and this is true in both years among those working in care employment. And for the differences by sector, the public sector has almost all permanent jobs, whether you're in care employment or not. In the private sector, it's a slightly higher share of permanent jobs in care employment, but a much lower level in private sector employment. So the privatization means more people are ending up in this sector. We also looked at working poverty. So here we're looking at folks having earnings below, such that they'd be below the poverty line considering dependency ratios. And we're seeing an increase in working poverty in the first panel, in both care and not care employment, slightly in care employment, a little more so in not care employment, right? So the rise in working poverty is sharper for not care employment. In terms of differences by gender, working poverty is higher for women in care employment, so they're in lower wage jobs, but men have witnessed a larger increase over time. Now, the percent of folks who are working poor is interestingly lower in not care employment when you look within sectors. So in the public sector, half are working poor within care employment. In the private sector, 69% are working poor within care employment. So this is an area where we see, particularly for care employment, low wages. So I'll turn to that next in a little more detail. But to summarize the working conditions, the situation in care employment is usually better than not care employment. And the situation in the public sector is better than the private sector. But we're seeing deteriorating working conditions between 2012 and 2018. And women are usually in a worse off situation compared to men. And there are a lot of women in this. So turning now to that wage point, this graph is showing log monthly wages by care employment and sex. So the solid line is the total. And then we're comparing care employment to not care employment. And if you look back in 2009, there were very similar wage levels. And for men, there was even an initial care wage premium. The care sector actually earned a little bit more than other jobs. And for women, neutral, right? And when we do additional analyses too, by public versus private, this is driven by the public sector. That's where the public sector had a care wage premium. Now, there's been a lot of fluctuations, but real wages increased over time in other segments, but decreased over time in the care economy. And so what we see in the latter period is that care wages, starting around 2015 and thereafter, are lower than non-care wages. So there's this divergence. Partly, this is a privatization effect. Lower wages in the private sector as it becomes more privatized, that means care wages fall. There's been less of a decrement for women over time in care employment than for men, but this declined over time within the public and especially the private sector. So there's this care wage penalty forming There didn't used to be a care wage penalty back in 2009. Now by 2021, there is. So we'll try to conclude and think policy thoughts too here. So we saw the care economy shrinking and privatizing. This is tied into structural reform and efforts to shrink the public sector. We saw working conditions, particularly social insurance and wages, worsening in the care economy and more so than in non-care work. They were and remain better working conditions aside from wages, despite the deterioration, but the trend of deterioration is very concerning. They're complex gender dynamics, more informalization, privatizing, but less of a wage penalty for women over time. So some complex gender dynamics there. So what are the policy implications of what we find, and thinking like about the care economy going forward, what should we think about, and creating decent working conditions there? So we know from global research that public provision of care services improves the job quality of care employment. So it's usually public provision that tends to raise the quality. And we're seeing in Egypt, the privatization is part of the deteriorating working conditions. So as we're thinking about developing a new social contract that ensures availability of care services, this may require revisiting the role of the public sector. The public sector may have to either fund or deliver or both care services and thus provide care employment. Now, long-term, universal coverage of care services by public provision or at least public funding could be one long-term goal, an expensive goal though. So you might need to start by targeting the most vulnerable in the short run with well-funded, high-quality services in terms of the care economy. And that should raise working conditions. There are also mixed market models that are options, right? So care services could be subsidized or provided publicly for the most vulnerable, and those with more resources can pay for services on the private market. So we make sure that there's high quality services for the most vulnerable, and thus decent jobs are created, and then the private market for those who can afford it. It's really, a lot of research emphasizes how critically important to robust paid care services and job quality is having sustainable public funding for paid care work. So sustainable, like a steady flow of funds, guaranteed, good funding mechanism.
Thank you, Caroline.
All right, do you want me to finish up with these last two slides or am I out of time?
You have 2 more minutes, okay?
2 more minutes, perfect.
Yes.
I have 2 more slides. All right, so in terms of care job quality, ensuring workers in the care economy have decent working conditions is very important, both from the perspective of workers' rights and well-being and for the quality of care. When you have high rates of turnover in care fields, it may negatively impact the quality of care. This actually creates a bit of a tension between the affordability of services and their quality. Higher pay for care workers can improve the quality of care, but make such services less affordable. And we also have concerns in terms of gender norms interacting with the professionalization of care. So we'd love to see the redistribution of unpaid care work into the market or redistribution within the household. But gender norms may limit this redistribution and may constrain professionalization and quality of care. For example, 68% of Egyptians thought household duties should not be compensated or that they should not be considered work. So this would include care work. And so norms change may be an important complement to investing in the care economy and creating decent work. All right, I'll stop here. Thank you very much.
Excellent. The good news we had an hour or 2 ago is that the ELMPS for 2023 is now available. And no?
It's in the field.
It's about to appear. Yes,
in the
so
field, not available.
You may have to revise some of what you've just told us. I hope. Okay, so we have 2 professors here who are going to tell you what they think of the work you've been doing. I'm very impressed myself with some of the numbers that I hadn't noticed before. And I'll come back to that once we hear from our speakers. Dr. Heba Nassar from Cairo University. Please go ahead, and you have 10 full minutes. Can you all hear?
No.
Oh, perfect.
I want to invite the ERF for inviting me to this very interesting seminar today. And I want also to thank the authors for this very interesting paper. If I start with the importance of the paper, economy, you find that it is a very useful work within households, and in particular for women, and women can then increase their participation in the labor market. So it's an important, very important issue. In particular, if we know that the paid work is in our countries in Arab region is around 53% of employment, and that 2/3 of women employment are in working in paid work, and 31% of this paid work is in Egypt is in public sector, in comparison to, for example, 16% in Jordan. So they are tackling really an important and significant sector in the economy. And in this sector in particular, we see the issue of feminization of economic activities, including social work and domestic work and all that. So which is associated usually with the devaluation of the forms of work. So and still all the efforts now to privatize or to expand privatization is considered to be leading to unfavorable work conditions. So the research is important, and in particular that when Irene, you have done something on a comparison on paid area. It was not statistical like this one, and with 3 data sets, and it was really tiring for me. It was somehow descriptive and very nice. And to my surprise, when you ended at 2017, I found so expanding decent jobs in the care economy in the private sector can be a major driver, and the same result that I got from this research. So I'm thinking there must be a value added in this paper, not just the model using, which they have done really what they came out. What we heard now is very much related to what we say the gender segmentation of the labor markets. So it is the gender segmentation of the labor market, it is the theories of gender segmentation. Usually they were only classified by race, color, economic, and then wage system, education, the labor market theories by females, males, and we have what's called the gender segmentation at the national level. So does the female labor market have specific characteristics? We can apply it on the care economy. Is the place of women marginalized? Do the characteristics of unemployed females differ from the characteristics of unemployed men? In addition, I will not add here, in addition, there is gender segmentation at the enterprise level. Men and women might have different labor market experiences within the same institutions through national labor, though national labor laws treat them the same, they might get different wages. Entry-level jobs are likely to be different for men and women, so that segregation will be maintained throughout one's career in the firm, and women's job ladder may be shorter. In Egypt, the labor market was found to be highly segmented by female gender, meaning that women do not usually employ in the same professionals, which is vertical segregation. So I find that somehow she was talking about the working conditions and the female-male gaps in the last four last criteria, that they are very much responding to what we heard about labor market segmentation, and which is the visible improvement now in females' participation, and in particular in the care economy, conditions in the private sector, socio-economic conditions that continue to limit the mobility of females, and growing unemployment, underemployment, declining real wages, persistent occupational segregation. So if I relate what I have heard today to what we know about the which is very important. I just want to tell you that I was a little bit confused and somehow when I was reading whether I'm reading about care economy, or always when you discuss the care economy word paid, and you find it when you go through that it is care economy. So I don't know, are you talking about the paid care economy or in general the care economy? This will be easier for me and for others to understand. Like when you خلاص بس working conditions بس طب خلاص 2 minutes 4 minutes. No, you have disaggregated care into care occupations in لا هنا it's important care occupations in care organizations, non-care occupations in care occupations, then non-care occupations in care organizations or in non-care organizations. What about accountants in the, which you mentioned, in the hospitals, lawyers in the hospitals? Can you, with your lump sum and generalization of discussing the working conditions in the sectors, have them all together like domestic workers in the hospitals? I mean, it's very difficult here to lump sum and talk about working conditions in the different sectors where you have lawyers, accountants, and you have domestic people. Also, you have public, private, formal private, and informal private, but never public private, and then we say that the conditions in the private are lower than our we see and differentiate between private informal and private formal. Differentiate between domestic workers and differentiate between the professionals in the
Okay.
But okay, in the discussion, and I really congratulate you because it was very interesting and I enjoyed reading it.
Well, it's always a hard job to comment on such a fabulous work, and even harder to comment after Dr. Hiba Nassar. So I'm going to be brief. So first, I'd like to thank Caroline and May for such rigorous paper. Now we have a reference on Egypt, on care employment, care jobs. I'm very happy to find this paper because it's kind of put Egypt on the map of care jobs studies. You know, we have Okay, so I think we have some studies on care jobs and the investment and simulation of what if, like, instead of countries investing in physical infrastructure, they invest in care care sectors in the region. And in Turkey, for example, in some of the low-income countries, middle-income countries, but then this paper really puts Egypt on the map of studies, and I'm very happy with that. But then also the results are validated from several nationally representative data, so LFS, ELMPS, which are all in harmony, pointing to the same results. The main results are four. I'm going to very quickly go over them. Paid care employment has been shrinking as a share of overall employment, including the public and the private sector. But then there is a bittersweet result for women, because women's employment in care jobs has increased over time, but then their working conditions deteriorated, and there is a the care pay gap that has formed. Now the paid care jobs are more privatized, but they're slowly growing and are not compensating for the retreat of the public sector in this important domain, which is the care economy. I'll start with the care pay gap because I feel it's driving the working conditions somehow. So the care pay gap has formed. Care workers earn lower wages than other workers, and now the privatization has its toll on working condition, including, which is more relevant to me, the widening social insurance gap. Now, how to do that? Okay. Now, the first implication of these results is that it means that there are serious challenges for redistributing, reducing, and valuing of care work. And why is this important? Because basically the care paid sectors are one of the most important employer for women. So if we find shrinking or deterioration in their working condition, that is really concerning. But also the care economy helps what we call redistribute and reduce and some of the unpaid care work, especially with the child care, sometimes elderly, but also the indirect unpaid care work to market provision. Now, there is a point that jobs in care work, and I second here Dr. Hiba, jobs in care work is heterogeneous. So the composition of occupation between health and education professionals to childcare and maybe social care workers, personnel workers, and domestic workers is critical. There are there are different jobs within the care sector, but then there is an important segment is that the workers outside of a fixed establishment, in actually those in households, right? The care workers who work for households, those most likely wouldn't label themselves as care workers in any survey, right? So perhaps this is a limitation, that there is a fraction of paid care sector that won't be captured in surveys, even though surveys would be nationally represented because of the stigma. All right, I only have one slide left. Now, my third point would be social insurance declining over time and rapidly for women, and I iterate here the costly formality. The key here is the wage. In the paper, they say the wages. So one of the figures that caught my attention is that childcare workers in the private sector receive on average 1,281. Recall this morning, the minimum insurable wage in 2021 was, I think, 1,400. So the minimum insurable wage is definitely beyond this figure, this average figure for the childcare workers. Hence, actually, their social insurance coverage is really, really expensive for their employers and for themselves. Now, there are many policy discussions around it, but now, given the importance of the care economy, I really want to look at how Egypt is faring in terms of GDP investment in health education, but also how is the institutional framework and conditions for care facilities like nurseries, elderly homes, etc., is paving the road towards working conditions and growth patterns. I think this is kind of like, my understanding is that the GDP investment in health education and else is kind of stalling, perhaps. Now, the second point is that the job quality in vulnerable care sectors is a critical issue, not only because it means the reservation working conditions in this sector is going down, and then it's becoming hostile to women if this trend continues, and then we are going to lose one of the most important employers for women, basically. But then it also affects quality of service provision. And the service provision in the care economy is really important for the human development and for the investment in human capital. So I think it's really important to think about this global issue. And it's not for the paper, it's just for our debate now. And now there are related policy issues that Carolyn mentioned, some of them. I think there is a need to invest in national time use surveys to know more about unpaid care work and how can we redistribute some of the unpaid care work toward care provision. But also we need to seek to change gender norms. And importantly, we need to fight the stigma. Now, care jobs, especially those care jobs in the early childhood and education, early childhood education and development and elderly care, I think it needs professionalization and regulation. So we need to kind of establish and strengthen corresponding areas of specialization in tertiary and vocational degree programs, provide on-the-job training, regulation, enforcement of quality. So all of these would actually, and towards changing norm, would actually give value and fight the stigma. Thank you.
May we give 2 minutes to each?
Yes, can I just, Dr. Raghi and Yasmin were very kind to keep their closing comments for tomorrow because we will be escorted out shortly out of the hall because there's another event. So if we can wrap up in 2 minutes, I'd be very grateful.
Okay, the way I'll wrap up, everybody, because we have no time, is just read from the short summary that we were given by May and Caroline. 3 pieces of data that I think should drive us to reconsider a lot of what we're doing on the ground with the poor in terms of the care economy. The first piece of data is that worldwide, they tell us the care economy employs 19.3% of employed women, whereas in the Arab states, it employs 53% are women. So we can see how much women in our part of the world culturally are prone to want that sector to work in. And here I beg you to consider, and if there's time tomorrow that we should raise this question, the extent to which the Arab world has a huge not-for-profit sector that works both on education and on health. And if you help the poor, you can do a huge, huge job, which is what I'm doing on the ground in 5 governorates in Egypt, 5 of the poorest. The second piece of data was that the care employment in wage employment fell from 20% to 17% over the period of 10 or 12 years, but 3.3 million workers were employed, representing 17% of wage employment and 59% of women's total wage employment in 2021. So I think, you know, the extent of the opportunity there, you know that Egypt, along with other Arab countries, has this enormous NGO sector, which is underutilized. They have space. They are close to the homes of those who need the medical care, who need the schooling, who need all of the care economy. And the last piece of data was that the share of the private sector in the care employment rose, according to their data, from 13%, only 13% in 2009 to 23% in 2021. I can see it on the ground, both the not-for-profit sector and the private sector is trying to make way into these sectors. We must encourage it all we can. Thank you. And
thank you very much. And Dr. Raghi, please take